What do you do when someone sneezes on you in public? Earlier, I used to think it's very disgusting. But ever since the COVID-19 pandemic started, it's quickly gone from becoming a thing of disgust to a thing that frightens me. I find it dangerous. So a few months ago, I was on this packed flight to Calcutta, and this gentleman next to me, he sneezed on me. And then he turns to his wife next to him, and he says, I have a pain in between my eyes, and I think I have very high fever as well. So I turned to him and I pointed at the newspaper he was holding. And I said, okay, so which virus are you planning to kill me with? Zika, Nipah, COVID, Chandipura, swine flu, bird flu, chikungunya, or dengue? And he answered quite politely for someone I had just accused of attempting to murder me with a virus. He said, what do you expect me to do? I cannot stay home. All it'll do is bring me financial and social pain. You just have to accept that diseases are all around us. And I did wonder about his words later on, that was he right? That even a pandemic like COVID-19, which had a national lockdown, we couldn't control the spread. It did spread. So are we all just at the mercy of viruses then? This is Sonalia Charchi, and you are listening to Health Wealth, a weekly guide to the science and sanity behind human health and well-being. A study published in the journal Nature back in 2008 looked at global trends in infectious diseases, and it found like over 30 human pathogens or 30 infections that have come up in the last 30 years. 75% of them originated in animals. So if news headlines have started to make you feel that disease is just around the corner, it probably isn't altogether an incorrect assumption. In fact, there is a virus that hasn't been found yet, hasn't been named yet, and there are people already worrying, and some people are even believing that disease X is already here. Is there anything that we can do that will allow us to go out peacefully and return home without making a mental list of the precautionary medicines we have to take? I thought instead of just focusing on clinical symptoms and how public health systems should gear up for the next pandemic, we can also spend some time today discussing how do we reduce this extreme fear of diseases, because sometimes fear takes away our ability to be rational and make good choices for ourselves. So we have with us today someone who is at the very heart of diseases, working as she does at Medanta Hospital in Gurgaon. Dr. Sushila Kataria is an internal medicine specialist. And I came to know her as the woman who was the first to treat a COVID-19 patient in the state back in 2020. Hello, doctor.
Hello, Sonali. Thank you very much for having me on the podcast today. And
Thank you
thank
so
you
much
very
for
much for
coming.
the introduction.
Thank you. Thank you. I still remember back in those days, it was such a big thing. First COVID patient and who is treating, and it felt like a murder mystery happening. We were all trying to find out the most that we could. Um, when I was researching on viruses to ask you about, I made a list and it started with Chandipura, Zika, and Nipah. And then suddenly I'm like, oh God, I forgot dengue. And then I'm like, oh, I forgot bird flu is back. And then I said, oh, COVID has started again. So suddenly it seems like we're just surrounded by infection. So why do we have so many viral outbreaks happening?
So that's interesting. And yes, all the viruses which you have told are true. They are existing, but some are more widespread, something like dengue, which is more seasonal in India, but in some countries it is throughout the year. And some are like limited pockets, like you spoke about Chandipura and the Zika virus and Nipah. So they come like in small pockets, and fortunately, they die down in the small pockets because their transmission is not that fast. Why is it happening too much? Is one is that because of the population growth. So, and that population is mobile. So earlier people used to get one infection, they would stay in that locality and the virus would not get time to jump. Now a virus can take the route of full of the globe within 24 hours because of our mobility and population. Secondly, because the population puts the burden on the environment. So we are invading more of our forest, and we are interacting more with the wild animals, which was not there earlier. So this human and wild animal interaction would definitely bring something new. So they were in their nests, and we were in our separate areas. A lot of intermingling, and then all this leads to the interaction between man to man and man to animal that is happening. And the people also think that some of the viruses may be originating in the labs, but that may be more of a conspiracy theory. I mean, but
Yeah.
still some viruses are being made to check how things are working. And yes, it is also true that the lab standards have to be good, so that wherever you're storing virus, like the smallpox doesn't exist, but it is stored in 2 labs in the world. So one has to be sure that the security and the safety nets are very good, which I would like to assure everyone that it is. So it is not very easy for the virus to get out of the lab, but it is very easy for the virus to get out of the forest into us and from us to us.
Yeah. And if you could explain a bit about endemicity, because I believe at least Chandipura, it comes every few years. And so what determines when it breaks out, and what determines where it breaks out?
Right. So there are 2 terms. One is called an epidemic and one is called an endemic. And so epidemic is when you have more than expected number of cases. Like you did not have anything in Gujarat last year, but now you have some cases of Chandipura, which is in an area. This was not last year, last to last year also. So this is way more than what we expected. And it is to some areas, so it becomes epidemic. When it spreads to different countries, then it becomes pandemic. Endemicity, on the other hand, is that something like we are used to it. It happens, like flu is endemic, typhoid in India is endemic, malaria in India is endemic, tuberculosis is endemic. That it doesn't cause a lot of hue and cry. The numbers are as expected, smoldering, sometimes little more, sometimes little less. It doesn't go away, and we have made peace with it. That becomes endemic.
And there's no way to predict when it'll surge again and when it'll fall.
So epidemic of very rare viruses, it is difficult to predict. But sometimes, there are some epidemics which you predict. Like if there is a flood, you will predict an epidemic of gastroenteritis and then typhoid and then followed by the mosquito-borne disease. So this you can predict after a national calamity. You can predict if somebody like after the earthquake, there were those rats, and then in Latour area, then you had some plague cases. You could predict that. But very rare disease and unusual transmission, something like this Chandipura is through sandfly and all that. It is not very 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 common, so it is difficult to predict. Flu endemic epidemic, that every year in a particular season the numbers would increase. And it is like dengue, that after the monsoon season starts, you are likely to have vector-borne diseases, like you will have more of dengue cases, chikungunya cases, and the malaria cases. So it is not very difficult. It is not impossible to predict, but the newer babies on the block, yes, because we do not know that how it exists, how it transmits, and because the occurrence of that event is so rare that it is not possible to predict. But like Nipah, if after some time only we got to know that it is associated with bats. So areas which is infested with fruit bats, where people eat bat meat, you can predict that something exotic would happen there.
Yeah. You mentioned the sandfly virus, which transports Chandipura. And this doctor in Gujarat recently told me that earlier, the sandfly could only fly to a height of 3 feet. And I believe it's now evolved enough to fly higher. And unusually this time, it's not just happened in rural areas, it's also happened in urban areas. The fact that the vectors or, the animal or whatever is carrying this virus, they are also evolving. How concerning is that from a, medical perspective?
Yes, I mean, this is the nature is under constant change. The dynamics keeps changing. Everything is evolving. From the Big Bang thing we have reached here. So obviously, it's not only we are evolving. Everything is evolving and trying to be smarter. Then our intervention also selects the smarter ones, which we call the theory of natural selection. So earlier, the mosquito would be killed by DDT spray and all that. Now, you kill 90%, but the 10%, those resistant or the smarter ones, survived, and then they proliferated. So the native population of mosquito, which was sensitive, it died down. So our intervention also selects what is suitable for the environment. And obviously the dynamics is changing, the vector is changing, the virus is changing. You have seen the evolution of COVID over last 3 years.
Yeah,
We
yeah.
started with native, then we went to Delta, Omicron, and now there are so many names, even we can't remember all the vocabulary.
Mhm.
So
Mhm.
yes, the world is under a constant change, and change is the only thing constant. We can't do anything about it. So yes, we have to accept it. We have to modify our ways. But as you said in the very beginning, the paranoia has to die down somewhere. The
Yeah.
world still exists. So we have to stay sane. Worrying about and taking precaution is a good thing, but all the time, which the thing which keeps on going, like your co-passenger, let if he says, what could have I done? So I would have said, you were having a fever and a cough cold, you could have worn a mask. That
Yeah.
would have increased my
Yeah.
chances of having an infection. So maybe everybody wearing all the time is not possible, but somebody who's having a cough and cold, it
Mm.
is still doable. Like I do my OPD, and as soon as I look at the patient's face, and so the smarter ones,
Yeah.
there are 50% people after COVID who, if they have symptoms, they're coming wearing mask. So a
Mm.
patient wearing mask is more important than me wearing mask. So, but still, when I see a patient on the door, I would immediately go and wear my mask. So these are the changes. This, we have become smarter, but this is one way of living with it. Another way is that you're still not coming out of the house, your groceries being delivered, you're fumigating them, and all the time you are wiping the surfaces. So it has taken the pleasure of living.
Mm.
So it's health and happiness should coexist.
Yeah, I agree with that. Um, Another thing which, very often doctors tend to lament over is that people don't reach on time for treatment, or, they have the symptoms and they're just sort of waiting for it to magically get better almost. So if I could point out a few diseases one by one, and maybe if you could tell me a couple of symptoms and how to do the diagnosis or when to do the diagnosis, starting with Chandipura.
So Chandipura is like more of a pediatric disease, and I think in that particular area where the cases are happening, I mean, any child or teenager developing fever, headache, and becoming little dull, small children not feeding, or becoming little dull and headache. I think it could just be simple viral, but it could be this. So in those areas where it is there, then one has to be and throwing seizures or becoming unconscious. Then one has to go immediately. So rather, why wait till the patient gets unconscious? Somebody gets fever in your area, you're seeing cases. The child is having headache. What is the harm in going early and getting tested?
Hmm. Yeah. And what about swine flu?
So swine flu is a flu influenza virus family. So
Mm.
influenza, I think after besides COVID, if any more pandemics have happened, it has always happened because of the flu related.
Mm.
It could be swine flu, it could be bird flu, or any other variety of flu. Flu viruses can come in a different composition. We have like H1N1. So the H part is about 18, the N part is about 12, and then you have different combinations. So that goes into hundreds. So flu, yes, if somebody has a comorbidity and somebody starts feeling short of breath, or
Mm.
in on doing routine activities, you are having fever, but going to the washroom, bathing yourself, dressing yourself, eating becomes a problem. That means you could be having a viral pneumonia. It may happen in 1 to 2%, and that too, children lesser than 5 years of age, people more than 65 years of age. If somebody is diabetic, that too not very well controlled, or having a already existing respiratory problem like bronchial asthma, COPD, even a mild fever, cough, cold is a signal that one should
Mm.
consult. And here I would also like to add that flu vaccine is effective, it is freely available, and people should use it.
And it works against both swine flu, regular flu, and bird flu.
Yes. So the swine flu lineage has been a part of this quadruple antigen vaccine, which is coming for last 10 years. So
Mhm.
it has been there, and it is always upgraded. It's kind of a little guesswork, little bit of intelligence that which virus will be prominent in this season. So they make this permutation combination with the help of WHO, and with a lot of just surveillance laboratories are there. So they change it every year because the virus is smarter. It is also changing, but yes, it does protect against swine flu.
And what about the Nipah virus? When does one test for Nipah infection?
So unlike swine flu or bird flu, This is a little rare one. This is more to do with the this is exotic, which comes from the zoonotic disease we call, from the wild animals to human beings. And here it is mostly either the bat, the this fruit bat, or it is the pig wear which contains this. So any contact with the dead bat, somebody eating a bat meat, or some fruit, some eatables which may be contaminated by the excreta of the bat and which has not been cooked properly. So something raw eating, or in that area it is infested by a lot of bats. In those areas, if somebody is having a fever, and it has a high mortality also, so it, like you may not be able to suspect in the first one, because you would not jump to say Nipah on the first go. You start with fever, headache, or altered sensorium. Could it be meningitis? Could it be bacterial, viral, or tubercular meningitis? Then you would do a CSF examination, and after you have excluded and you see that similar things are happening in a bunch of people in the same family, or somebody who's been exposed, that's how you suspect it, and then you send special test, because Nipah test is not available in your neighborhood laboratory. You have to send it to a special, the NIV, the National Virological Lab.
Yeah, I think you have to do that for Chandipura as well right now.
Chandipura as well. Yeah, the exotic ones, because it's not freely available, because it is not commercially viable to have this test with every lab, because you'll get one sample probably in a year. So it is good to have a consolidated national run laboratory, and that's why I mean, and NIV Pune is doing a wonderful job, and you have some labs now working in Delhi as well.
Yeah, I like this. We've got exotic fruits and vegetables, and now we have exotic diseases as well.
Exotic disease, yes.
And what about dengue and chikungunya? I mean, I think most people know about the symptoms by now, but I believe there's you have to test after a certain number of days or something, or the test comes negative. Is that true?
Good, you asked me about dengue and chikungunya, because this is something very, very, very close to my heart. COVID got a lot of limelight and a lot of research happened, but I would like to tell you that mosquito-borne disease have been our biggest enemy, and more people have died because of mosquito-borne diseases than all the wars in the world put together. So it is such a big thing, and it happens every time. So dengue, and it is viral infection. Mostly viral diseases do not have a specific antiviral drugs. Like if somebody gets a malaria, you know that I will give this medicine, it will get better. So dengue is a big problem, and it affects small children. It affects people who do not have any disease. Their immunity is very good. And there's about 1 to 2% mortality where people get this hemorrhagic fever and this. So there is a lot of misconception in general public about platelets. People feel that platelet is everything. Yeah. I say platelet is a bystander. It has nothing to do. It will fall and it will rise by day 8 or 9, and it has nothing to do with the severity of the disease. Somebody who's having fever, you can test on the day 1 also, because through the antigen testing. If you're doing antibody, then day 5. But if you're doing the NS1 antigen ELISA test, it will be positive on the day 1 of your blood also. So you could test on the day 1. Somebody gets fever, monsoon season in the area where I live, where I come from, we have a lot of, right now, fever has started. So do not take any stronger NSAIDs like Combiflam, Brufen, or Ibuprofen, or Diclofenac, because that will harm your system. Do not take any intramuscular injection to relieve fever. Get yourself tested. Hydration is the most important thing. And very important thing, if somebody is retching badly, intake is very poor, stomach pain is there and becoming listless, we say a narrow pulse pressure. That is the difference between your upper wala blood pressure and the lower one, the systolic and diastolic. If it starts to get narrow, like if you have a BP of like 110 by 90, this is a narrow pulse pressure. So that means your capillary leak phenomena has started. Or if somebody is gradually getting CBC done on day 3, 4, 5, then you'll see if the hemoglobin has started to increase, that is a sign of worry that you are dehydrated. You have not built up your hemoglobin, you just dehydrated. So somebody with a false pulse, with a narrow pulse pressure, or with a rising hemoglobin, or a constant retching. If you haven't done any test, there's a constant retch and there is a severe abdominal pain, time to go to the hospital.
Yeah.
But chikungunya, fortunately, it doesn't affect children and young adults that badly. It affects more of the elderly population, but the pains are so much that people just can't get up from the toilet seat. So in this condition, if elderly people and then they become little abtunded and their urine output gets to go low, then they should be admitted, because chikungunya and encephalitis can happen, and sometimes you see the patients having an acute kidney injury as well. So for dengue, I think I would like to reiterate that this is a time to do all the preventive things, wearing full sleeve clothes, sleeping in the mosquito nets, putting mosquito repellent creams, and drinking lots of water. And even if when you get a fever, do take paracetamol, hydrate yourself well, and get tested at the earliest.
Yeah. And I'd like to talk a little bit about, this word that all of us are crazy about, immunity. Because we are all convinced that immunity determines how bad an illness will be. And I have a shelf in my house, which I call the COVID mistake shelf. And there are goji berries and neem and potions and I don't know, everything I bought under the sun at that point to improve my immunity. Um, is it guaranteed? Like, if is diet the only thing that guarantees you good immunity? Um, and what other factors are important? Like, for example, sleep and stress. I mean, I know these have some linkages with immunity as well. So, could you just explain this whole idea of how do we develop good immunity?
So immunity is as simple as somebody saying what's love and what's life. So it is as simple and as complex. So immunity is a sum total of lot of things. It's not your WBC, it's not your hemoglobin, it's not your albumin. It is the whole total of how your body would respond. Common thing is that poor immunity gets more sicker, but in some diseases, a strong immunity can backfire. Like in patients who have this dengue shock syndrome, usually have a very good and robust immunity. So immunity is a little can go both ways, but mostly yes, 99% good immunity is good for you. Now, how to get good immunity? People come that write me some good multivitamins so that I can get a good immunity, or some we brought our relatives are in US, they've sent this is good immunity, or this is some alternative medicine therapy which improves immunity. All of have heard and all that. But immunity is not a quick fix. Immunity is, you don't build up immunity overnight. The immunity starts building up when you are in your mother's womb. How good your mother eat, that very thing will determine a lot of things. How rested she was, how relaxed she was, what were the already existing immunological experience. That means what all infections she has had, and she has antibodies she passed on to that. Then we are born, then we develop a innate immunity, a general blanket. Like if I feel cold, uh, I will cover myself with a blanket. Then you have specific immunities, like you wear socks, you wear mittens, you cover your ear and all that. So that is a specific immunity which you earn during your lifetime. So having said that, there is an innate and there is a specific immunity, and you keep on getting immunity over time till you are about like 25, 30, your immunity keeps on boosting up. Once you cross the 40, then we call immune decline starts, and as the body starts to age, it even forgets what I am already experienced with. So that is the general part of immunity. But coming back to your questions, could diet only solve it, or could supplements? No, it cannot be. This is like a little bit you're doing for yourself every day. You need to invest your time in exercise. You need to invest in a good sleep, and good diet doesn't mean very expensive, exotic, or imported things, but whatever is locally growing, whatever is seasonally growing. So yes, all those who are seekers of immunity, good immunity with some medication, I'd like to disappoint them. But immunity is sum total of what you continue to do with yourself. But yes, having said that, if somebody has a low protein, it is good to take protein supplements. If somebody has a low hemoglobin, a hemoglobin supplement will definitely improve your immunity. And similarly, if somebody is deficient in vitamin B, C, D, B12, you could take that and improve your things.
Yeah. In fact, I was very surprised, but recently, now that sleep medicine is, sort of coming up, a lot of research is being done, and they're finding how sleep during that time of rest, your body uses it to sort of self-repair itself. And I know this that during COVID, there were some doctors who kept on insisting rest. Take it easy. Don't go running. Even if it's mild, don't go, doing 10,000 things. Just rest. Are there certain mistakes like that which you've come across in your clinical experience, where patients are doing something so wrong during an illness?
Yes, all the time. So sometimes, yes, knowingly, sometimes unknowingly, but yes. And so sometimes they will come and say the commonest thing is that I had viral and I have started azithromycin or augmentin. I said,
Yes.
that's a paradox because that's an antibiotic. This is a viral infection. So for most of the viral infections, they are self-limiting. Some can, continue for a longer time. Those are specialists. We can talk about that. So give body time and rest to heal itself. Things will get better. You don't need an antibiotic for for a viral infection. If there is an antiviral medicine which exists, you could use that. One is that. Secondly is that, yes, the sleep thing you told me. Many people believe that sleep is a passive process, but no, it is as active as an awake state.
Yeah.
My father-in-law used to say when I would wake up my son to go to school, and he said, let him sleep, he's growing. But so true he was. I mean, your growth hormones increase when you're sleeping. There are other 20 other mechanisms which becomes more active. So it's like, you run a business and the business is in the daytime, and what happens in the nighttime, you clean up everything, make it tidy for a beautiful next day morning so that your business runs very well. Sleep is like that. Sleep is an active process. Sleep is very underestimated, and because of sleep people make mistakes at work. Because of lack of sleep, accidents happen everywhere, in every field, in medical field and also. So sleep, if you have a choice between, people want to do everything nowadays. They want to go to the gym also, they want to have a social life also, they want to excel in their work, which is leading to less time to sleep. So what is happening, people will spend 1 hour in the gym and then sleep 4 hours and then go running in the morning. I think this kind of thing is not good. You have to make your basics first, then only you can add good things. Like when you make a building, you have to make a strong basic structure. Over and above that happens decoration. So eating right and sleeping well is your basic structure. One should not make any mistakes about this. And when you have viral, yes, I was the one who was telling people, don't overexert yourself. Take rest. Body has given you this disease so that you can rest and fix yourself. So there's never to hurry. I mean, why you have to go to the gym the very next day? What's the hurry? You can go 1 week later. Listen to your body all the time.
Health is something we take so much for granted till it goes away. It's you don't realize it, when it goes, you would do anything to feel better. So I know people. I think anyone would have to be blind to not know that antibiotics are not being used for viral infections today. Blind and living under a rock. I mean, even a blind person would know this, to be very honest. It's all over the place, but you just want to get better. And sometimes I feel it's also a lack of awareness of the various advancements that are happening in treatments, even for viral infections, or the growth of knowledge base. I mean, even if we don't have a treatment for a dengue, the fact that we know it so much more today. So perhaps, I mean, could you share a few things when it comes to viral diseases that have improved in the last few years? I think it gives people a lot of hope.
Yes, I think a lot of advancements have happened in treatment of disease as such. Our medical science has been progressing, and our average life expectancy has improved drastically. Almost it has gone, 1.5 times after independence. So things are happening because of sanitation, because of vaccination, and because of a lot of advancements. So specifically coming to viral infections. So like one viral infection is hepatitis C. And just 5-6 years back, there is now a course where you can cure it in 3 months time, where earlier we used to think it is a totally incurable disease. Secondly, HIV is a viral disease. When I was doing my med school, it was in early 90s. We used to think diagnosis means almost a terminal kind of a thing. Then the antiviral medication, the zidovudine, came in, and the patient was taking 21 pills a day with not too much of a response. And now people are taking just one pill with minimal side effects, and they live as better as somebody without this disease. Then coming to some viral disease, you have monoclonal antibodies. So you have prepared specific antibodies which could just go there and neutralize it. And advancements are being made in antiviral medications also. So, I mean, this is on the highly technical grounds. On a simpler grounds, as we know that for dengue, hydration is very important. Keep hydrating, monitor the hemoglobin, and you have to just pass over that capillary leak phenomena of once the fever breaks, after that the crucial phase starts. So when your fever settles suddenly, then those next 2 3 days are important. So don't think that my fever has gone away, I am better now. In
Yeah.
dengue, those 3 days are the most crucial ones when your fever breaks. So I tell my patients, I'm not worried as long as you're running fever. When you stop having fever, that is the most crucial time when you start monitoring your CBC more closely. So that is have been happening. Then there are a lot of filters being prepared, like you do dialysis, so you have some filters which will absorb the pathogens. So that technique is cyto-absorb filters. These are called, that technique is also being developed. Then there is very personalized care, like somebody gets this particular disease, then you will get according to your genetic makeup. Then many cancers, like everybody's lung cancer is not similar. So like our fingerprints, the tumor cells are also different. So you find out the molecule in that and target the molecule. So these are the newer advancements which are happening and will
Yeah.
continue to happen to make ourselves more comfortable taking the treatment and getting better.
Yeah. Um, if I may ask you one last thing, um, like I said at the beginning, you are at the heart of where diseases come in to get treated. Internal medicine, the department is constantly seeing, patients of all different types. How do you stay positive and hopeful? How do you not let the paranoia get to you?
I think I must be, that die-hard optimistic kind. So once the first COVID patients, the 14 Italians came in,
Uh,
and Dr. Trehan was given this option from the PMO to have those patients. And then he asked me and few of my colleagues, and then he said, what do we do? I said, he said, what do we do and how do we treat? I said, let's find out if this is something should be done. So it is something should be done, we'll figure out how to do it. Somebody has to do it, so why not us? If I'll not do it, somebody else would do it. So if somebody has the courage to do it, I also have it. So it's like this. And but otherwise, this, I mean, think more wisdomfully. This world is running, everything is happening, the process, there is a life, there is, everything is in order. So this will not go in disorder that soon, that easily. We have to be really foolish to put it to disorder.
yeah.
So if we keep on doing our basic things as for the infections, eat right, sleep well, wash your hand, and wear mask when you're unwell or when you're attending to an unwell person, get vaccinated, whichever is available. I think this is the simple mantra. We shouldn't make life too difficult. It is not to be, thought over, ponder over again and again.
Mm.
Do what is to be done, and then rest of the things, there are a few things, there's a force above which will also put it to the order.
Yeah, I think there's so much of focus on non-communicable diseases today. And I think it's because somewhere we feel we have a choice with those. We can control whether we get diabetes or not. We can control whether, we'll get hypertension or not by, changing our diet and so on. With infectious diseases, we feel like we're at the mercy of the environment around us. But then I recently discovered that we do have a choice. We have a choice to go to the doctor on time, to get the blood test done on time, to take the right medicines, to go to the right doctor on time as well. Um, and I just want to really thank you for giving us the different right choices that one can make when we have viral infections. Thank you.
Thank you, Sanali. Thank you very much.
I want to read out 2 lines very quickly. The structural proteins of SARS-CoV-2 include membrane glycoprotein M, envelope protein E, nucleocapsid protein N, and the spike protein S. I swear to you that when COVID-19 began and I saw these sort of lines emerge, I was so sure I'm not going to be able to do any work on this because I'm not a science student. And then for 3 years, I was producing one story a week on the virus. And it happened because I accessed the knowledge and wisdom of those who knew so much more than me. I would get almost a class a week from a doctor or a virologist or a geneticist. And the reason I share this, it's because doctors or bioscience researchers or healthcare workers are not as off limit as you think. If you ask questions, they will answer. I have never met a doctor who will say, I won't answer that. They might give a short answer. Some might be better at explaining things, but they will always answer. I had an eye ache recently and I found an ophthalmologist on Instagram and I messaged her and said, I'm feeling too lazy to find the right specialist, but this is what's happening. Who do I go to? and she helped me. I mean, I did have to go and pay for my treatment and my consultation, but she was happy to do the guiding because why would a doctor say no to making you feel better? So if you feel overwhelmed or confused, a lot of that uncertainty and the poor choices you make can be reduced if you just go to the appropriate person for answers. How do you stay safe from infectious diseases? And did you also, like me, think that Chandipura was the name of a mithai and not a virus? I'd love to hear about your experiences with health and well-being. You can write to us at pods@indiatoday.com, or you can message us at 8588 966 And if you enjoyed this episode, I hope you'll leave us a good rating. We are available on Apple, Spotify, and YouTube Music.